In this podcast episode, Andrew Huberman delves into the intricate relationship between stress, emotions, and physiological responses. He aims to provide listeners with a comprehensive understanding of stress, its implications for mental and physical health, and actionable tools to manage it effectively. Huberman begins by clarifying that stress, while often perceived as a negative experience, is a generalized system designed to mobilize various brain and body functions in response to both psychological and physical stressors. He emphasizes that stress is not merely an emotional state, but a complex physiological response that can be beneficial in short-term situations. For instance, stress can enhance immune function and sharpen cognitive abilities, preparing the body to respond to immediate threats, whether they are environmental or psychological. The stress response is initiated by a network of neurons that activate the sympathetic nervous system, leading to the release of adrenaline, epinephrine. This response prepares the body for action, increasing heart rate and redirecting blood flow to essential muscles while inhibiting functions that are less critical during stressful situations, such as digestion and reproduction. Huberman highlights that understanding this mechanism is crucial for effectively managing stress. Huberman categorizes stress into three timescales: short-term, medium-term, and long-term. The acute stress response, which occurs in immediate situations, can be beneficial. It primes the immune system and enhances cognitive focus, allowing individuals to respond effectively to challenges. However, prolonged exposure to stress can lead to negative health outcomes, including anxiety and depression. To manage acute stress, Huberman introduces the concept of the physiological sigh, a breathing technique that can quickly activate the parasympathetic nervous system, promoting relaxation. This technique involves taking a double inhale followed by a long exhale. The physiological sigh helps to regulate heart rate and reduce feelings of agitation by reinflating the tiny air sacs in the lungs, which can collapse under stress. This simple yet effective tool can be practiced in real time, making it accessible for anyone experiencing stress. Moving beyond acute stress, Huberman discusses medium-term stress, which can last from several days to weeks. This type of stress requires a different approach, focusing on raising one's stress threshold. He suggests that individuals can build resilience by deliberately placing themselves in mildly stressful situations, such as high-intensity exercise or cold exposure, while simultaneously practicing mental relaxation techniques. This process helps individuals become comfortable with higher levels of activation, allowing them to manage stress more effectively over time. Huberman also emphasizes the importance of cognitive regulation during these periods. By learning to calm the mind while the body is activated, individuals can dissociate their emotional responses from physical sensations, ultimately increasing their capacity to handle stress. Long-term stress, on the other hand, is detrimental to health and well-being. Huberman warns against chronic stress, which can lead to serious health issues, including heart disease and mental health disorders. He stresses the importance of maintaining a balance, ensuring that stress levels rise and fall throughout the day without preventing restorative sleep. To mitigate long-term stress, Huberman highlights the significance of social connections. Engaging in meaningful relationships, whether with friends, family, or pets, can enhance feelings of well-being and reduce stress. He explains that social interactions can stimulate the release of serotonin, a neurotransmitter associated with feelings of happiness and contentment. This connection underscores the importance of investing time and effort into nurturing relationships, as they play a crucial role in emotional regulation and stress management. In addition to social connections, Huberman discusses several non-prescription supplements that can aid in managing long-term stress. He mentions ashwagandha, which is known to lower anxiety and cortisol levels, and L-theanine, which can enhance relaxation and improve sleep quality. However, he advises caution with melatonin supplementation, as it can have negative effects when taken in high doses. Huberman emphasizes that while these tools can be beneficial, they should be used in conjunction with lifestyle practices such as regular exercise, adequate sleep, and mindful breathing techniques. By combining these strategies, individuals can create a holistic approach to managing stress and anxiety.